hands?
So Lobo, I've only had him for about 2 years, not even 2 years next month. He came into the Long Beach Animal Hospital as a cruelty case, evidence in a cruelty case trial from the Long Beach Police Department. So he came in, you know, he was in pretty poor condition otherwise, everywhere, but specifically the front limb had a lot of muscle atrophy, nerve degeneration, and it was kind of knuckled and non-weight bearing. So yeah, so I think we amputated him mostly in the hopes that, you know, someone would see him and give him a home if we just kind of patched him up, you know, made him look cute and sent him off to animal control. So he went off to animal control for about 3 days before I just went and picked him up.
Oh.
So he came here, he gets acupuncture and he gets what are those, active exercises and stretches, physical therapy stretches. He did really well from his sessions about a year ago. He did 12 sessions a year ago. Yeah. And then he did so well that, you know, we kind of stopped coming. And then more recently what happened was I think that it was just like an acute on chronic kind of problem where he kind of always had this bad back, this bad lower back. And a lot of spinal cord compression in various places. So it started to act up again, and he had been running around probably a little too much because we don't really confine him. He does whatever he wants. And so we came back, and then within, I think, 2 or 3 sessions, he was back on his feet.
I think when you came in, he was like collapsing.
Yeah, so what we do is after the patient gets their evaluation, then we'll give them the home exercise program, and that's tailored, you know, specifically for their condition. The treatment I do is pretty much, you know, totally different than their exercises they have at home. But I mean, as far as the technique for stretching and all that, the owners do it relatively the same.
We teach them how. So they come in and we show them, these are what you're going to do. And then we actually go through and show them how to feed each and every one. Because, you know, you have to know not only how to do it exactly, but, you know, the hardest part is knowing, you know, how to not hurt your dog. That's the hardest part. So.
Good to you, good boy, Lobo.
So what I'm doing with Lobo now is, again, just some scapular mobilizations. And then you can, mobilizations can be anything from just little to actual like adjustments with them to get more range of motion in whatever plane you're working on. So with tripods, what you would see is typically just overuse. A lot of things are just become overused. With Lobo, he's you know, because he has to bear more weight on this extremity, then everything kind of gets tight.